upper end and where is the lower end of the spinal cord? When the spinal cord is start and when it is finished?
The neck was the neck.
From the neck, which part of the neck? C1.
Repeat the question. Repeat the question.
Where is the upper part and where is the lower part of the spinal cord? I told you the spinal cord is located at the vertebral column, okay? And then at the vertebral column. Cervical. The best things that we can say from the upper end is when the brain is finished, okay? When the brain, which is located at the skull, the brain includes in several parts. For example, we have cerebral hemisphere and then we have brain stem. The lower part of the brain is something we call it medulla oblongata, okay? And after the medulla oblongata is finished, the spinal cord is started. Or maybe we can say that it is started from at the level of C1, a little upside to C1. It is started. Where is the end of the spinal cord? At which? Coccyx. That's true. Another one, another answer. Is it true? At the coccyx? At which level? At the spinal cord ends at the which level of vertebral canal or vertebral column? Someone said that at the coccyx. At the level of coccyx. Is it true? No. At the last? No. In the lumbar. At which level? L5, no. Between L1 and L2. Between L1 and L2. So the upper part of the spinal cord is at the foramen magnum. I told you about the foramen magnum. Do you remember in the previous semester? I told you we have a big foramen at the base of the skull. After that, we have the spinal cord. It is located at the vertebral canal and until where? Until between L1 and L2. Okay? I will tell you why it's located at L1 and L2. At first, I have a question. The spinal cord changes with age or not? Or for example, the spinal cord of us is similar to a fetal or it is similar to a newborn? No. What is the differences? What is the change?
Spinal cord change after
before the birth.
Yes.
What happened before the birth and what happened after the birth?
In newborn, they have no curvatures, the normal curvatures in the spine. The lordosis and kyphosis, they are different from what they are in
No, I'm not talking about the shape of the vertebral canal. I just say about the length of a spinal cord. For example, you told me that the lower part, the lower end of the spinal cord is between L1 and L2. Okay, someone said coccyx, I said not true. At between L1 and L2 is the true answer. L1 and L2. Okay, this is the end of the spinal cord. What about before birth and what about young child or newborn?
Before the birth, the vertebrae not fused. Coxial not fused.
No. Tell me about the level. I'm saying that in adults at the L1 and L2. Tell me before the birth. For example, at L3, L4, L5, S, coccyx.
At the coccyx?
At the coccyx. It's true. Before the birth, at the coccyx. You are seeing here. What about after the birth?
T12.
No. At L3. These are the differences in the spinal cord length. Before the birth, at the coccyx, young child L3 and adults L1 and L2. What is the reason for this event? What happened to spinal cord?
Cartilage.
Because spinal cord change it and increase and decrease.
No. Not decrease. Think about that. Before the birth, coccyx, young child L3 and adults L1 and L2. Imagine that. Look at here. This is the vertebral canal or vertebral column. And this is the spinal cord. Okay. This one is before birth or after birth? Before birth. It's before birth. Okay? Because I told you the spinal cord, for example, this is C1 and this one is coccyx. Okay? The spinal cord is located at the vertebral column and it is started from C1 until coccyx. But what happened after the birth? Again, we have this one, but the spinal cord is at this level. For example, L1 and L2. What happened? The differences is as the result of speed of growth. It shows that, for example, imagine that I am the vertebral column and the speed of my growth is, for example, 1 centimeter. I grow 1 centimeter and the spinal cord again 1 centimeter. These are similar. It shows that when the vertebral canal or vertebral column grows 5 centimeters, the spinal cord again grows 5 centimeters. So, as the result, we have vertebral column and the spinal cord occupies all parts of the vertebral column. So, it is started from C1 to, for example, coccyx. What happened after the birth? It shows that, for example, I am the vertebral canal, I grow 5 centimeters, but the spinal cord grows 2 centimeters. Again, 5 centimeters, this one is 2 centimeters. This is the differences between the speed of growth. The speed of growth of the vertebral canal is more than spinal cord. So it causes that the spinal cord, which occupies all parts of the vertebral canal before the birth, occupies at the L1 and L2 after the birth. Okay? For example, imagine that 2 persons are running. One of them is athlete and running very fast, another one running slowly. So we have the differences between them. This is the reason that we have spinal cord changes with age, before the birth and after the birth. I will tell about that in the next slides. This is the spinal cord change. Okay. A spinal cord length. How much centimeters is the spinal cord in our body? Tell me the number. 20. The spinal cord length in our body. How much centimeters?
It depends on the body.
Yes, it depends on the, for example, the tall man, tall girl, or lower. But we have a normal range. For example, the length of me, for example, is similar of you. Maybe 5 centimeters, 6 centimeters, okay? It's not big difference. So the spinal cord length is 42 to 45 centimeters. Okay? 42 to 45 centimeters. And also I told you, it occupies the upper 2/3 of vertebral canal. What does it mean? It means that this one is vertebral column. It occupies 2.3 because we have the vertebral canal at coccyx from C1 to coccyx, but the spinal cord is at C1 until L1 to L2. So it occupies the upper 2/3 of the vertebral canal. And also I told you about the length was 42 to 45. Look at here. What is the shape of a spinal cord? The spinal cord, I told you, it's cylindrical in shape. It is started from upside and come down. At which level it ends? L1 and L2. Okay. I'm telling you, it's cylindrical in shape, but the end of the spinal cord is something like this. Okay? The end of the spinal cord is something like this, at L1 to L2. We call this part, the end part of the spinal cord, as conus medullaris. So the conus medullaris is the end part of the spinal cord here. Is conus medullaris. I told you every important organ must be protected. The protection for the spinal cord was vertebral column. Another important protection for the spinal cord is something we call the meninge. Did you hear something about the meninge? Meninge layer. We have something we call this meninge. The meninge layer includes 3 parts, or includes 3 layers. Dura mater, arachnoid mater, and pia mater. What does it mean? It shows that, for example, this one is a spinal cord. You are coming, you are getting.
There are no chairs. There are no enough chairs.
This one is a spinal cord, okay? The spinal cord is protected by one layer. We called it pia mater, okay? Pia mater. After that, another layer comes and again protects. We called it arachnoid. Another layer comes and covers the spinal cord. We called it dura mater. So, the spinal cord, after that, pia mater, after that, arachnoid, and after that, dura mater. Dura, arachnoid, pia, and spinal cord. These 3 layers from one side and again from another side comes and cover the spinal cord, okay, for protection. So the spinal cord is surrounded by 3 layers of meninge, I told you. And where is the end level of this part? I told you the spinal cord ends at L1 and L2. Okay. What about the meninge layer? What about the meninge layer? This one, the pia mater. The pia mater is the internal layer of meninge. Okay, imagine that this one, spinal cord and this part. The pia mater covering the spinal cord. Until which level? Look at here. The pia mater is covering the spinal cord, at this level. Does it end? No, it continues. It continues. It protects the spinal cord and then continue. Continue to where? Continue until coccyx. Because in the vertebral column, we have cervical part, thoracic part, lumbar part, sacral part, and coccygeal part. Okay, so it is started at the upward, okay, and surround the spinal cord, comes. At the L1 and L2, the spinal cord is finished. But the pia mater continues. Okay, understand? this part of the pia mater, we called it phylum terminal.
diameter coat filament.
Yes, the pia mater continue at this level until this part. We say pia mater. After the spinal cord is finished, because I told you the spinal cord finished at L1 and L2. After the L1 and L2, we said phylum terminal. So the phylum terminal descend to where? Descend to attach the posterior surface of coccyx. Okay? Understand? This is about the pia mater. What about other layers? I told you we have arachnoid and dura mater. The arachnoid and dura mater are here, come until S2. So the dura mater and arachnoid ends at S2. Understand? So the arachnoid and dura mater ends at S2. The spinal cord ends at L1 and L2. And the pia mater continues until L1 and L2. After that, from the L1 and L2 until coccyx, we call it phylum terminal. And the phylum terminal attached to coccyx. Okay? Understand? I will ask you at the exam about the level. Be sure. This is one of your questions. The pia mater ends at which part? The dura mater ends at which part? The spinal cord ends. Okay? So this is very important. Another thing which is important for us is this level. Look at this part. I told you the spinal cord ends at L1 and L2. Okay? Between L1 and L2. Look at here. L1 and L2, the spinal cord is finished. Do we have sacral nerve or coccygeal nerve, all R3, L4, L5? We have or not?
Yes,
We have. Because I told you we have 31 pairs of spinal nerve. Okay? It emerges from where? It ends at L1 and L2.
And the branch from the
That's true. After this part, after the spinal cord is finished, from this part we have something like this. These are the nerves. Why this is in this shape? Because of the spinal cord changes with age. I told you, before the birth, we have spinal cord in all parts. It means that the spinal nerve, for example, cervical nerve goes out at the cervical part. The thoracic nerve, something like this. Okay? Coccygeal nerve, sacral nerve, thoracic nerve, cervical nerve. But what happened after the birth? After the birth, it's something like this. We have coccygeal nerve, sacral nerve, lumbar, thoracic. Okay? But after the birth, because it doesn't occupy all parts of the vertebral column, it's something like this, the direction of spinal nerve. Because we need sacral nerve, we need coccygeal nerve, but it doesn't occupy all parts of the vertebral column. So the direction of the nerve is something like this, not something like this. This is before birth, this one is after birth. Okay? So at the end of the spinal cord, at this part, I told you this part is very important for us. After L1 and L2, we need nerves. But how nerves? It's something like this. It goes from the foramen of coccygeal. It goes from the sacral foramina. You understand? We call this part, we call these types of nerves in this situation, we call them coda acuina. The coda aquina in English means the hairs of the horse. It's something like the hairs of the horse.
هي شعر الحصان. شعر الحصان.
I don't understand Arabic. So this is the hairs of the horse, or we call it coda aquina. Okay? So tell me, what was the conus medullaris? What was the conus medullaris? The end of the spinal cord here. I told you it's uniform, it comes, the end of the spinal cord is something like this. We called it conus medullaris. How many meninge layers we have? 3 layers. From internal to external, pia mater, arachnoid, dura mater. Okay? The pia mater ends at which level? Coccygeal. It comes and at the name of the phylum terminal attached to coccyx. The spinal cord ends at L1 and L2. The arachnoid and dura mater S2. C2 is here. Okay? The S2. At the S2, the arachnoid and dura mater ends. What does the coda aquina mean? What is this?
Coca hairs.
Yes, what is this?
Terminal coccyx.
The spinal nerve.
Explain. Yes.
Look at me. We have foramen in the vertebral canal. For what? For the nerves goes out. Okay? We need cervical nerve. So the cervical nerve goes from cervical part. The thoracic nerve goes from the foramen of the thoracic part. The lumbar goes from the lumbar part. But we have the spinal cord just at L1 and L2. But we need L3 nerve, L4, L5, S1, S2. But the spinal cord ends at this level. But here we have sacral part and coccygeal part. So the spinal cord, from the spinal cord, the spinal nerves emerge and pass from the sacral foramen. Emerge and pass from sacral foramen. Emerge and pass from coccygeal part. Okay, because we have 31 pairs of spinal nerve. Okay, understand? Question? So these are the names I told you. We have one name. We called it lumbar cistern. Where is the lumbar cistern? Where is the lumbar cistern? I told you the spinal cord ends at L1. The pia mater ends at coccyx. The arachnoid and dura mater ends at S2. From this part, when the spinal cord is finished, this part is the end of the spinal cord. The end from this part until the rest of them, we call it lumbar cistern here. Something like a bag. At the level of the spinal cord is finished until the coccygeal part. We call it lumbar cistern. Look at here. This is the spinal cord. The end of the spinal cord, I told you, we call it conus medullaris. After the conus medullaris, we have coda aquina, the hairs of the horse. Okay? We call this part as lumbar cistern. If I ask you, at the lumbar cistern, what we have? Tell me, what we have in the lumbar cistern? Coda aquina, it's true. Another one. Tell me, what we have here?
Dura mater and arachnoid.
Dura mater and arachnoid. Again, another one.
Vena.
I told you, what is the name of pia mater after L1?
Phylum terminal.
Phylum terminal. So at the lumbar system, we have phylum terminal, we have arachnoid, we have dura mater, okay? And also we have coda aquina, okay? These are the contents of lumbar system. I have a question. Do we have a spinal cord at lumbar system? No. Because the spinal cord ends at L1. After that, we have lumbar system. The lumbar system includes phylum terminal, coda aquina, arachnoid, and dura mater. Okay? And why this part is important for us? Do you remember in the previous session, I told you about cerebrospinal fluid, or CSF. I told you the CSF is made by ependymal cells at ventricles. Okay? They secrete. Imagine that, for example, we have lots of cells here, they secrete fluid into this space. Okay? After that, this fluid comes to third ventricle, fourth ventricle, then comes to spinal cord. For what? For protection again. Imagine that you have a glass of water. Okay?
Don't get the spinal cord. Give longer to the spinal cord.
It arises from the spinal cord, these ones. Imagine that you have a glass of water and you have lots of cotton, lots of silk. Okay? We call this glass of water with lots of silk as lumbar system. Here is a glass of water. Do we have water? No, we have CSF, cerebrospinal fluid. The cerebrospinal fluid is located here. You are seeing. The CSF is made at the brain, comes to spinal cord and protect the spinal cord. So in the lumbar system, we have CSF, we have phylum terminal, we have arachnoid, we have dura mater, and we have coda aquina. These are the contents of lumbar system you are seeing at this view and this view. And if I pass something, it's not related to you, it's more than. Look at here, this is the shape of a spinal cord. I told you, the end part of the spinal cord, we call it conus medullaris. Is it uniform or not? Look at here, this is uniform, or in some spaces, in some location, it has an enlargement, or it is big. In cervical, it is big. Another part. In the lumbar part. Why the spinal cord at cervical part and lumbar part is big?
Because the initial process.
Have what? No, it doesn't relate to touching the bone. No.
Have a lot of process to the shoulder, to the, I think, to the upper undervolume.
Again?
Have a lot of process to the upper undervolume.
That's true. We have enlargement in spinal cord for what? We have cervical enlargement and lumbar enlargement. In the cervical enlargement is the place that the spinal nerve wants to go to upper limb. In the lumbar enlargement, it's a place that the nerves wants to go to lower limb. Okay? For example, the most important parts in your body is upper limb and lower limb. What is the differences between upper limb, muscles of the upper limb, and the muscles of, for example, trunk and neck? What is the difference?
The lower limb or upper limb movement.
That's true. About the movement and a special function. For example, with the muscles of your trunk, you do what? Just breathe. Okay? Just breathe and a little protection. Okay? Or maybe you want to flex, for example, your back. But with the muscles of the upper limb, you can write, you can get, you can, for example, swim, you can everything. You can do everything. or by means of the lower limb. You can walk, you can shoot, you can get something, okay, or jump, or stop something. So the functions of upper limb and lower limb is more than in comparison to other parts. So they need lots of nerves. They need special nerves. And these nerves arises from cervical enlargement and lumbar enlargement. Okay? So if you see, I ask you, uniform thickness or not, you say not uniform. Because at the cervical part and at the lumbar part, it is big. Cervical enlargement and lumbar enlargement for innervating the muscles of upper limb and innervating the muscles of lower limb. Understand? I told you about the coda equina. Okay? The hairs of horse arises from the end of the spinal cord and it comes to lumbar sister. I told them spinal meninge, dura mater, arachnoid, and pia mater. Okay. Another name for dura mater is pachymeninge. If you see at the book, you must understand. It's pachymeninge. Another name for arachnoid and pia mater, leptomeninge. Okay. Another thing that we have is something this denticulate ligament. What is the function of ligament in our body, in all parts? Ligament. Attachment of what?
Muscle.
Attachment. Okay. Imagine that I'm saying to these girls, for example, you must stay here and winds are coming. Or for example, I threw a lots of water. What will you do to stay at your situation? You get the hands, okay? You start from here to here. You are getting the hands of your friends. By means of these ones that we say ligament in anatomy, okay? You stay at your place. So we have denticulate ligament for what? It is started from the pia mater and attached to dura mater. Internal layer to external layer. It causes that the three layers of meninge stay at the situation. Okay? The denticulate ligament you are seeing, ligamentum denticulatum or denticulate ligament, 21 to 22 pairs started from the pia mater and attached to dura mater. If I ask you what is the function of what is the function of denticulate ligament, you must say that for being stable or being together, the meninge layer. I told you we have 3 layers of meninge. This is very important, and I'm asking one question. If you at first hear and then if you ask, you will get plus for your exam. I told you we have a spinal cord. After that we have pia mater, arachnoid, and dura mater. Okay. Do we have spaces between them or they are sticking together? We have several spaces. Okay. One of the space is epidural, another one is subarachnoid. Maybe you are seeing at your cell phone or tablets. The subarachnoid, it means below the arachnoid, okay, or under the arachnoid. Under the arachnoid, it shows that it is located between which layers?
Between the arachnoid and the dura.
No,
Below.
Below.
Between arachnoid and pia mater. So this part, this one is arachnoid, this one is pia mater. This space is subarachnoid space. And also we have another space, we call it epidural. Epi in anatomy means around or outside. outside the dural or around the dural. It means that it is located where?
Dora.
Outside of the dura mater. Here.
Surrounding.
Okay? Yes, surrounding. So we have epidural space and subarachnoid space. You are seeing at the slide, I wrote it for you. Both of this space is useful for inducing anesthesia. Okay? So, when the doctors choose epidural space for inducing anesthesia, and when doctors use subarachnoid space for anesthesia, which of them is better and why? For example, imagine that you are a doctor and you need to do a surgery. Okay? You have this space for inducing anesthesia and you have this space for inducing anesthesia. What will you do? Which of them is useful? Which of them is better?
For the surgery.
Raise your hand and say.
Even Dura,
Epidural is better for what?
because don't come to the spinal cord. Because it's around.
It's what is the advantage?
Don't damage in the nerves.
Completely true. So the epidural is a little safe, okay? Because imagine that it is an injection, okay? It is coming, okay? If this injection comes to this part and release the substance, inducing the anesthesia at epidural space. So the dura mater, the arachnoid, the pia mater are safe, okay? So the epidural is a little safe. So, but I wrote it for you. The doctors also uses subarachnoid for making anesthesia. Why?
Very strong.
Faster.
Very strong what? Your friend said that the epidural space is better because it is safe. Okay? But why the doctors uses subarachnoid space also for making anesthesia? If it is not safe, why they use?
Because it is fast.
Fast, no.
Stronger unnecessary,
What?
stronger anesthesia. It's necessary sometimes.
That's true. Based on the condition. For example, a doctor needs lots of time for surgery or needs effective anesthesia. It uses subarachnoid. It's danger, but he or she uses subarachnoid space because it gave him a lots of time for do the surgery. But this one, the epidural, is superficial, but it's not danger. So this one is safe, this one is more effective. These are the differences between subarachnoid space and epidural space for inducing the anesthesia. What is the function of a spinal cord?
Motors. Motors. Support the body.
Support the body, what? How support the body?
About the muscle.
If I remove your spinal cord, what happens?
We can't move or anything
How you cannot move?
because it is a motor and sensory attachment. Motor, sensor and motor.
That's true. The spinal cord has three functions. One of them, getting the sensory information from outside of your body
To the brain.
to the brain. For example, you are touching something and your brain understands that you are touching. Or you are, for example, touching a hot thing, your brain understands this temperature. Okay? Or for example, you cut your hair, you cut your hands. Your brain understands and you feel pain. How? The spinal cord receives the information, the sensory information, and send it
To the brain.
to the brain. Then brain start to process, analyze, and then send the information or motor information. And from the spinal cord it goes out. And after that, for example, when you are touching the hot things, you move your hands. Okay? So, sensory information and motor information. The motor information for example, moving one muscles. By moving the muscles, flexion and extension, you can do something. So these are the two functions of a spinal cord. Another function, coordinates the reflex. What is the reflex?
When you touch, yes, when you touch or have involuntary.
That's true. Involuntary movement. Involuntary movement. Did you hear anything about the test that by the hammer knock the knees? Okay. After one or two kicking the knees, you suddenly or unconscious, you move your knees. What happened? This happened. This reflex. At the normal condition, without the involuntary things, or we are getting the information from the skin. It shows that the information comes to the spinal cord, then from the spinal cord goes to brain. Then brain decide and send the motor commands to the spinal cord, and after that the motor part goes to muscle. This is the normal condition. But in the reflex, what happened? The sensory information comes to the spinal cord, but don't go to the brain. The spinal cord decide and sending the motor. When it happened, for example, your hand is burning. Okay, you touch a very hot thing. If you state that the information comes to the spinal cord, then goes to brain, then the brain decide and send the motor.
Is here.
You lost your hands.
Yes.
Okay, so your body needs that. The information comes to the spinal cord decide and send the motor, and you move your hands. Okay, so the reflexes occur in emergency situation. Something, for example, the knocking the knees reflexes, or when you touch a hot thing. These are the differences. At the normal situation, for example, the information comes to the spinal cord, goes to brain start to analyze, start to process, then send the messages, and from the spinal cord it goes to muscles. And for example, you start to write. If you want, for example, write coda aquina, at first your brain must decide that and say that at first you must write C. After that you must write A. Okay? Something like this. But at the reflex it is difference. I told you we have 31 pairs of spinal nerve. Okay? The spinal nerve have sensory information or motor information.
Both of them.
Both of them. It shows that you have 31 pairs of spinal nerve, and they have sensory information and motor information. How it happens? Look at here. Completely here. And completely be at the class, because from this slide is very important. Look at here. This is a section of a spinal cord. What is the section of a spinal cord? For example, I'm looking at you. What I'm seeing? I'm seeing nose. I'm seeing glass. I'm seeing scarf. I'm seeing, for example, hairs or eyes. Can I see your liver?
No.
Or heart? Or lung?
No.
How I can see them?
A sensor.
By means of CT scan or MRI. Okay, by means of a section. Okay, I have a section from your body and I can see inside. You are seeing inside the spinal cord. Okay, when you, for example, I bring the spinal cord from corpse and looking at you and showing at you, you are seeing that, for example, it has some features in external, but you cannot see the internal of the spinal cord. If you want to see the internal of the spinal cord, you must see the section. What we have at the first session, I told you we have gray matter and white matter. The white matter is the myelinated axon. And what is the gray matter? The soma or precaryon and also dendrites.
Yes.
Okay? So you are seeing here, the spinal cord is something like this. The spinal cord is something like this. It's like H-shaped
Butterfly.
or butterfly. This is the gray matter. This is the section of the spinal cord. Here is
Gray matter.
gray matter. Where is the white matter?
Surround.
Here. This is white matter. So the gray matter is H-shaped at the middle. And what about the white matter? Around. Okay. What happened to make a spinal nerve? I told you, by means of the sensory information, you get the sense or sensory information from outside of your body. Okay? So, look at here. We have something, we called it DRG, or dorsal root ganglion. It's a type of neuron. Okay? It's outside of the spinal cord. It sends the dendrites to a skin and receive the information. It carries the information to DRG and then by means of axon comes to spinal cord. So by means of this process, your spinal cord getting the information from outside. Understand? After that, it comes to spinal cord, then goes to the brain. Then brain analyze, process. For example, it goes to brain. Then brain start to analyze and sending the motor comments to the spinal cord. What happens? After that, the information goes out of the spinal cord. To where? To make the spinal nerve. Look at here. This is the dorsal root ganglion or DRG, getting the information, coming to spinal cord. The information goes to brain decides and sends information, and it goes out. Until where? Between the vertebra, we have intervertebral foramen.
Yes.
What is the intervertebral foramen? For example, she is C3, I am C4. Between us, there is a foramen. And I told you the foramen in anatomy is for
the
arteries and veins and nerves. Here, the nerves are important for us. So before the intervertebral foramen, between me and another vertebra, we have one foramen. Before this foramen, the sensory information and the motor information coming together. Okay? So this is the sensory, this one is motor. They are coming together and make this one. Make spinal nerve here. So you must understand that this spinal nerve has sensory information and motor information. Understand?
Yes.
This is the spinal nerve. 30 pairs of spinal nerve. Getting the information and sending the information. After this foramen, I told you, before the foramen, the sensory and motor coming together. After this foramen, it divides to two ramus, or two branches. Okay? Between us, the spinal nerve goes, and at this part, it divides to two parts. One of them come to the back,
Yes.
dorsal ramus. Another one come to anterior part, ventral ramus.
Yes.
What is the function of dorsal ramus? The muscles and skin of the back. Every muscle, every skin in the back. Innervating.
Yes.
What about ventral ramus? The skin and muscles of anterior part. So anterior ramus or ventral ramus and dorsal ramus or posterior ramus. Understand?
Yes.
And this ventral ramus, you are seeing, which of them is thicker, ventral or dorsal?
Ventral.
Ventral. The ventral is thicker than. And the ventral is participating to make what? To make plexus.
Plexus.
Did you hear anything about plexus?
Yes.
What is the plexus?
Um,
Form the plexus. Cervical, brachial, intercostal, lumbar, sacral. Why they are important for us? Because you understand that the upper limb, for example, innervating by means of brachial plexus. C5, C6, C7, C8, and T1. These are making brachial plexus to innervate the muscles of upper limb. The muscles of lower limb, lumbosacral plexus, lumbar sacral, lower limb. And also intercostal nerve for the muscles of between the ribs. The cervical plexus, the muscles of the neck. Okay, understand? These are the ventral ramus and dorsal ramus of the spinal nerve. These are some information about the spinal cord. From this slide, you are seeing the surface features of a spinal cord. It means that if you bring a real spinal cord, what you can see? Okay, what we can see in the spinal cord. Come here, you come here, you come here, and you come here. Stand here. Come. Okay, and you go. If you look, imagine that here is a spinal cord. They are something like a groove for passing something. For example, passing the nerves or passing the artery. Okay? Do you remember when I say about the occipital bone, I told you we have mastoid notch, or we have a groove for occipital artery. Okay? In the mastoid process of occipital. In the spinal cord, we have several sulcus and fissures. For example, you are seeing from the anterior of the spinal cord. At first, we have anterior median fissure you are seeing at the slide. Okay, anterior median fissure. We have two anterolateral sulcus. Okay, two anterolateral sulcus, one anterior median fissure. Understand? You come, and you come. Stand. Come here. Another one come, please. You come. Come here, stand here. Okay, come. Another one. Okay, stand. Come. And stand here. You are seeing a spinal cord from anterior and posterior. We have anterior median fissure, anterolateral sulcus, and anterolateral sulcus of another side. Again, we have posterolateral sulcus and posterolateral sulcus of another side, and posterior median sulcus. I told you one of them is fissure Another one are sulcus. It means that the fissure has a more depth. Okay? It has a more depth. So we have this sulcus and one fissure. What is the function of them? I told you, we get the information and we send the information. By means of the posterolateral sulcus, they give the sensory information. Okay? The sensory information comes to the spinal cord by means of posterolateral. It comes to the spinal cord, for example, comes to this part, and then goes to brain. Then brain analyze and process and send the message to a spinal cord. And it goes from which sulcus? Anterolateral. So the anterolateral for sending the motor and posterolateral for getting the sensory information. Understand? These are what we have in the about the fissure and sulcus. In some spaces in the spinal cord at C1 to T6, we have 2 extra sulcus. But before that, I want to say another thing. Another thing which is very important for us in neuroanatomy is the tract. Tract. What does it mean? For example, we have lots of tract. For example, we have lateral spinothalamic tract. It carries one, for example, information. We have lots of tract because we have lots of sense. We have pain. We have temperature. We want to understand the pain, the temperature, or the sense of the upper limb, the sense of the lower limb. They come to a specific part. Between the anteromedian fissure and anterolateral sulcus, we have anterior funiculus. You will see the words. Anterior funiculus of one side, anterior funiculus of another side. Between anterolateral and anterior median. So tell me, before posterior median and posterolateral we have posterior funiculus. Okay? And between anterolateral and posterolateral we have lateral funiculus. This funiculus is related to some tracts. For example, the gracilis and conatus tract we have, it's related to the sense of upper limb and lower limb. Okay? For example, I told you, the brain wants to know about all the things in our body. The sense of the lower limb comes to which part? Is it happen, for example, is it possible to, in one day it comes to this funiculus, tomorrow it comes to this part, another day it comes to that part. Is it possible? No. The sense of upper limb and lower limb have a specific location. Where is the specific location? At the, for example, at the posterior funiculus. So it shows that the sense of the upper limb and the sense of the lower limb just come to this part. I am the posterior funiculus. It is not possible that the sense of upper limb comes to anterior one. Just posterior funiculus. And also, look at me. I told you here we have posterior median sulcus and posterolateral sulcus. And I told you in C1 to T6 we have an extra sulcus. Mean posterior intermediate sulcus. What does it mean? Posterior, it shows that it is located at the posterior view. Intermediate means between. So the posterior and intermediate mean is located between the posterior median sulcus and posterolateral sulcus. And what is the function of mean? I divide the posterior funiculus in 2 parts. One of them here, that's true. One of them is medial, another one is lateral. The medial is gracilis, related to the sense of lower limb. The lateral, conatus, related to the sense of upper limb. So you must know that the sense of upper limb and the sense of lower limb comes to posterior funiculus. And also you must know that gracilis comes to medial part and conatus goes to lateral part. These are the sulcus that we have in spinal cord. And also, after this part, tomorrow, we will talk about the medulla oblongata. Okay? The medulla oblongata is the first part of the brain that we will study. I told you the spinal cord, the start of the spinal cord is the end of medulla oblongata. When it finishes, it is a start. So in the medulla oblongata, again we have this sulcus and fissure. Tomorrow we will see. Understand? Sit down, thank you. And you are seeing at the slide. Look at the slide. Anterior median fissure, posterior median sulcus. Anterolateral sulcus, I told you. Motor roots of spinal nerve. Posterolateral sulcus, sensory roots of spinal nerve. Posterior intermediate in cervical and upper parts of the thoracic, C1 to T6, and cannot be seen in the lower part of the spinal cord. Look at the picture. This sulcus, this one, anterior median fissure, posterior median sulcus, posterolateral sulcus, posterior intermediate, anterolateral. You are seeing all of the sulcus and fissure, which I show you by your friends. Look at here. I told you about this one. Fasciculus, gracilis, and conatus. And about the funiculus. Tell me. Look at here. This one is gray matter or white matter?
Gray matter.
The gray matter, H shape. Okay. And around it we have white matter. I told you between the sulcus we have funiculus here and here. So we have anterior funiculus. Here we have posterior funiculus. And between anterolateral and posterolateral we have lateral funiculus. I show you by your friends. Why the white matter is white color?
Because myelin sheath more.
Yes, it is myelinated axon. Okay, so we see it as white color. I told you about funiculus, I told you about the gracilis and conatus. Gracilis medial, it relates to lower limb. Conatus lateral relates to upper limb. Be sure that it is one question of your exam. And look at here. The white matter of one side and also the gray matter of one side must have connection to another side. Okay? It shows that the half of your spinal cord has a connection with another parts of your spinal cord. Look at here. We call this, we call them commissure. Commissure means connection. Okay? Ventral white commissure, dorsal white commissure. It shows that we have two commissure or two connection, one of them in the anterior, another one in posterior. Look at here.
Anterior.
Ventral white commissure or anterior white commissure. This part. Posterior white commissure or dorsal white commissure. Again, in the gray matter we have them. I will tell you. Look at here. Fissure, anterior median, anterolateral, posterolateral, posterior median, two postero intermediate, and you are seeing the funiculus, I told you. And I told you about the information. You told me the spinal cord getting the information and sent to brain. Which information? Sensory information. We have two kinds of sensory information. One of them is happen when you receive the information from outside of your body. And when the body send the sensory information, for example, the muscles and joints send the information to the brain. One of them is outside, for example, you are touching something, it's outside of your body. We call it exteroceptive information. Exteroceptive information originates from outside the body, such as pain, temperature, and touch. Another one, proprioceptive information originates from inside of the body. For example, muscles and joints. Rest for 5 minutes, then we continue. If be at the class at 5 minutes, don't go and after that one bus coming to the.
Well, we don't want to continue.
Take a rest. It's hard, take a rest. This slide I told you about the white matter and about the sulcus and fissures in the spinal cord. In this slide you are seeing the gray matter. I told you the gray matter is something like H shape in English or butterfly. It includes two parts, two lateral columns. Okay, for example, one lateral column, another one, and they are connecting to each other. This one, lateral column, they are connecting to each other. And at the middle of the gray matter, we have a canal. We call it central canal. What is the function of the central canal? I told you we have ventricles in our brain. Formation of CSF, cerebrospinal fluid, because I told you we have ependymal cells. The ependymal cells secrete CSF or cerebrospinal fluid. It comes to ventricles. After that, it comes to spinal cord for protection and also for waste clearance and the metabolism. So this one you are seeing, this part and this part. And we divide the gray matter of the spinal cord into two horns. This one this part. We have posterior horn and anterior horn. And between them, here we have intermediate part. Okay, posterior horn, anterior horn, intermediate part. Okay, tell me, the sensory information comes to which horn?
To the center.
That's true. The sensory information comes to posterior horn. The sensory information like touch, temperature, pain, okay, from inside of your body or outside?
Outside.
Both of them.
Yes.
Exteroceptive,
Yes.
proprioceptive. Both of them, the exteroceptive outside of the body and the proprioceptive from inside of the body, joints, muscles, okay? So the information, the sensory information comes to posterior horn, then goes to brain. And the brain sends the motor message. The motor message or motor commands come to posterior horn or anterior horn? Anterior horn. So the sensory information comes here and the motor information goes out from here. We are seeing here. I told you before the intervertebral foramina, they are coming together and make a spinal nerve. A spinal nerve. Okay? From posterior horn, anterior horn. And just this. So this part is related to movement and this part related to getting the sense or sensory. You are seeing, I told you, anterior horn, posterior horn. These are enough for you. the gray matter. Some scientists, it's just for yourself. One scientist, the name was Rexy, come and divide the anterior horn and posterior horn into 10 parts. Divide the posterior horn and anterior part to 10 parts. And he said that he said one part is as the lamina. So we have 10 lamina at the gray matter. The lamina 1, 2, 3, 4, 5, 6 is located at the posterior horn. The lamina 7 at the middle part or intermediate part, lamina 8 and 9 and the anterior horn, and the lamina 10 around the central canal. So if I ask you at the exam, which lamina getting the sensory information? Posterior horn. Which lamina? 1, 2, 6. Which lamina involved in motor function? 7, no. 8 and 9. 8 and 9. This one and this one. And what about the lamina 7? The lamina 7, what was the autonomic nervous system? I told you in previous sessions. Autonomic. Sympathetic and parasympathetic. Okay? The sympathetic and parasympathetic is located here because we have a specific nucleus. Okay? We have a specific nucleus in posterior horn for getting the information. We have a specific nucleus in anterior horn for sending the information. And here at the lamina 7, we have two groups. Intermedio-medial, intermedio-lateral. These are not important. But it's better you know that the intermediate part or intermedio-medial and intermedio-lateral is related to sympathetic and parasympathetic. Posterior for getting the information and anterior for sending the information. And I wrote it for you. The lamina 1 to lamina 4, getting the information from skin, from outside of the body, extroceptive. The lamina 1 to lamina 4, and look at here, it's not true. It shows that it's not true. The lamina 1 to lamina 4 getting from the skin, but the lamina 6 is getting the information from tendons and muscles. Okay? These are not important for you. And I wrote it for you, the lamina 6 related to information from muscles and tendons. And I told you the lamina 7, intermedio-medial, intermedio-lateral, parasympathetic and sympathetic. Lamina 8 and 9 related to the motor part, these are not important. The lamina 10 around the central canal, we pass. One thing which is important, gait control for pain. What does it mean? If some child falls in the street, mother and father did what? What happened? What did they do? You are a mother or you are a father and your child fall in the street. What do you do? Go to whom?
Help him to come.
Go to him. And do what?
To control the pain.
Take it. Take it or shake.
What? Push, no.
No, shake.
No.
Shake.
No. What will you do to decrease the pain?
Emotional support.
How?
By hug. Okay.
What happens when you are hugging something? When, for example, it might be happen for yourself, okay? When you fall, you started to do something like this, okay? Put the pressure, or touch, okay? By means of this work, your pain decreased. Or maybe you have a pain in your back. You go, for example, into, and you use, for example, hot water. Or massage, that's true. Massage is related to something I told you, Another one is going to, for example, hot water. What happened? By means of hot water and massage, the pain decreased. If the massage and the hot water, for example, or hot things, occurred, two things secreted. Enkephalin and serotonin. Where is it? Serotonin. The enkephalin and serotonin secreted. What happened after that? I told you the information comes to spinal cord. Maybe it has connection and it goes to brain. By means of massage and hot things, this part, I told you, we have DRG here, the dandruff, getting the information and coming it into spinal cord. By means of these two parts, serotonin and enkephalin, these synapses blocked. It means that the synapse between DRG and one part in the posterior horn is blocked. And your brain doesn't understand the pain. When you start to massage, okay, it doesn't mean that the pain is finished. No. The brain doesn't understand the pain. Okay? Because the pathway is something like this. The information must come to spinal cord, then goes to brain, then brain understand and process. But what happens if the information blocked here? So the information doesn't come to a spinal cord and doesn't go to brain. So the brain doesn't understand. So the scientists say that the spinal cord is gate control for pain by means of secreting the enkephalin and serotonin from the brain, and it comes and decreases the pain. Look at here. I have a question from you. What is the differences in the amount of gray matter and white matter in different levels? For example, upper cervical, lower cervical, thoracic, lumbar, and sacral. What is the differences between the amount of gray matter and the amount of white matter? In which level the amount of gray matter is increased and the amount of white matter increased?
Lower cervical. When the white matter increase, so nearly maybe big.
When? At which level? No. I'm asking, for example, I am the spinal cord, okay? Here is cervical, here is thoracic, this part is lumbar, and this part is sacral, okay? At which level the amount of gray matter is increased and the amount of white matter increased?
And lower cervical.
Lower cervical, why? You tell me, what happened? In the lumbosacral, what happened?
Attached together.
No, I asked you, gray matter, at which level is bigger than? You tell me lumbosacral, you lower cervical, why?
Because movement is more.
The movement is more. At each level that you need more innervation, the amount of gray matter is increased. Lower cervical and lumbosacral. Because the cervical part and the lumbar sacral part wants to innervate the upper limb and lower limb. So the gray matter at this part, and this part, you are seeing the amount of gray matter is higher than in comparison, for example, to thoracic one. Because the lower cervical wants to innervate the upper limb and the lumbar or lumbosacral wants to innervate lower limb. So the amount of gray matter here and here is increased. What about white matter?
Decrease in the upper. Increase in the upper.
Why?
The lower or upper?
No, why?
White matter same in lower and lumbar.
No, it's not the
This
same.
increase in the upper cervical, lower cervical.
The amount of white matter here, the amount of white matter at the superior part of the spinal cord is increased. We have lots of white matter in the upper part and less of white matter in the lower part. Why? Because, look at me, the brain sending the information. I told you the white matter is myelinated axon. Okay? The brain sending the information. So it shows that at this level of a spinal cord, we have motor information of upper limb and also lower limb, because the upper limb come here and goes to muscles, and the lower limb wants to come to this part and then goes. Okay? So at this part, at the cervical part, we have the myelinated axon of the upper limb and lower limb. Okay? Look at here. This is the spinal cord. This is cervical part. This is thoracic, and this one is lumbar. I told you from the brain sends the motor commands. Okay? If, for example, you want to innervate the lower limb, it comes to this part and then goes. And also, the motor part of the upper limb, it comes and goes. So, at this level, you have the myelinated axon of lower limb and also upper limb. But if you continue and come here, you don't have the axon of upper limb. Because at this level, it goes to hands and finish. You don't have the motor information of upper limb at the lower part. It doesn't need. It comes here and goes to the hands and arms and finish. But the lower limb continues and come here and goes to, for example, to the lower limb. Understand?
Yes.
So this is the differences between upper limb and lower limb. The blood supply. The blood supply, same as the other organs. You studied, for example, lung, liver, heart. Every organ in your body needs blood. Okay? What is the blood supply for a spinal cord? Do you remember aortic arch I tell you in the previous term? Do you remember?
Ascending and descending.
Yes. Look at here. This is aortic arch. This is the aortic arch. I told you in the right side we have brachiocephalic trunk, we have left common carotid and left subclavian. Okay? In the right side, then the brachiocephalic trunk divides to right subclavian and right common carotid. For blood supply of the spinal cord, two arteries started from the subclavian and goes upward. We call them vertebral artery. The vertebral artery arises from subclavian and goes upward. And they are coming together and make another artery, basilar artery. We will see tomorrow. From this part, vertebral artery, the branches come and supply the spinal cord, supply the blood for a spinal cord. From which part of the spinal cord? Did you remember I bring your friends here and show you the sulcus? I told you the anterolateral sulcus for motor information, posterolateral sulcus for sensory information. And also I told you we have anterior median fissure. Okay? The anterior median fissure is the location for anterior spinal artery. And also we have two posterior spinal artery. Where is it? Two posterior spinal artery. One anterior spinal artery from anterior median fissure. What about the two posterior spinal artery? Again from posterolateral. So you understand that from the posterolateral sulcus, posterior spinal artery, and the sensory information. From the anterolateral, we have motor information, and in the anterior median fissure, anterior spinal artery. What about the vein?
Segments.
We have 6. What's happening? What about the veins? The class is changing to mosque. I finished at 5 minutes, then you can go. What about the veins? How many veins we have? 6 veins. 6 veins as the sulcus and fissure. 2 anterolateral sulcus, 2 veins. Anterior median fissure, 1 vein. 2 posterolateral sulcus, 2 veins, and 1 posterior median sulcus, 1 vein. Okay, so by means of 3 arteries, supply the blood for a spinal cord, and by means of 6 veins, collecting the deoxygenated blood. This is the blood supply of spinal cord. I say just one word and then you can go. We have the tracts, I told you, the tract related to information, pain, touch, temperature, sense of upper limb and lower limb, and also the motor information, which started from the brain. We have ascending tract and descending tract. Tell me, which of them is sensory, which of them is motor?
Ascending motor.
Descending is motor, ascending is sensory. I ask you, and if someone answer, get a plus. Rubro, look, here. Rubro, spinal tract, is sensory or motor? Raise your hand and say. Rubrospinal tract is ascending or descending, sensory or motor? Motor, why?
Because located in the
Look at that.
anterolateral.
How you know that? Do you know where is rubro? Did you hear anything about rubral? Or if I ask you, for example, tecto spinal tract, this is sensory or motor? Tell me. What do you think? Or if I ask you, for example, a spinotectal, sensory or motor? This one is sensory, motor, sensory. You use ChatGPT. Why this is sensory? I want the reasons.
Tecto motors, because collection and extension.
How you know that?
Because sensory. When
How you can understand? It relates to sense or relates to motor?
muscles.
How? This is my question. It doesn't need that you know about the rubro or tecto. I ask you because it has a pattern. It doesn't important that, for example, I know that you don't know about the red nucleus or tectal, okay? You just know about the spinal cord. But by means of the name, you can understand that one tract is sensory or motor. How you can understand?
From the
If it is ascending
How we can understand one tract is ascending or descending?
Which one? Posterior?
No, it doesn't relate to posterior and anterior.
How it moves?
How it moves. I can say lots of the tract: lateral spinothalamic, corticospinal tract, anterior spinocerebellar, posterior spinocerebellar. Which of them is sensory? Which of them is motor? Someone said and get a plus.
What are them?
Word is proprospinal. It means propro come first and then go to spinal.
So it is sensory or motor?
It means ascending,
It is
and then it's the sensory.
Ascending motor.
you destroy your word. I wanted to say clap for you, but you destroy. Change it.
Changing it's proprospinal, then it's goes descending from robro to spinal cord, and then it's motor.
How you understand that? By means of the name. At first, a little clap for him. From the name you can understand. Look at here. Rubrospinal tract or tectospinal tract. I told you the lower part of the nervous system is spinal cord. Okay? It doesn't need that you know about the red nucleus or tectal. At first, you must know that the spinal cord is the lower part. So, you have one thing in this part, and you have another thing that you don't know the meaning. Red nucleus, tectal. It is located obviously upward or superior to the spinal cord. Okay? And you say that something spinal tract. It shows that it is started at something and comes to spinal cord. So it is descending. And the descending is sensory or motor? Motor. Or when I say a spinotectal tract from a spinal cord, we don't have anything inferior to a spinal cord. The spinal cord is at the inferior part. We have a spinotectal. It is started from a spinal cord and sent to something, tectal. It shows that it is sensory or motor? Sensory, ascending. Look at my hand. From a spinal cord goes to somewhere. Sensory. So, from the name, you can understand that which tract is ascending or sensory and which tract is descending from the name. Because all of the tract has two parts. A spinotectal. So, if I ask you, a spinocerebellar, sensory or motor? Sensory. Because it is started at a spinal cord and goes to cerebellum. It doesn't important that you don't know anything about the cerebellum. Okay? Understand?
Yes.
You can go.
Thank you.